Hello, everyone. Hello to everyone listening to this as a recording, and hello, everyone who's here. So today we're going to be talking about breathing exercises, specifically, what like the evidence around them, but also just like we'll go through a couple of three different breathing exercises that are helpful both for calming and then one for energizing. There's been a lot of talk about breathing over in the natural medicine world, and and a lot of it is more anecdotal. People say that they feel better with it, but the research really isn't there to back up a lot of the claims about breathing. But many people can say that they noticed a big difference. One thing I really do see as being important is awareness of breathing. We're going to talk a little bit about that sort of unconscious breath holding, and I do think that is something that a lot of people do that we actually has a profound effect on us physiologically. If nothing else, I think that's probably the most important thing. We also do know that getting this, I'll go through some of the literature about some of the deeper, slower breathing and how that really can help us in terms of circulation and in terms of oxygen usage and in terms of ability to really absorb the oxygen that we're getting as well. We'll talk a little bit about mouth breathing and nose versus nose breathing, which is has come to the forefront because of a book that came out. It was a few years ago. Oh, it was in 2020. It's called Breathe, it kind of came out right before the pandemic started. And by James Nestor, and he makes a case about how a very strong case about nose breathing versus mouth breathing. Some of which is evidence-based and some of which is a bit of a leap or a lot of a leap in my perspective. But we'll kind of go over what he was talking about, but also sort of what this sort of case is for nose breathing, which is really, it's a legitimate case for nose breathing for sure. So starting with kind of like what is the literature about deep breathing, and what is that, what kind of effects does that have? So slower breathing. So we're going to do the health class for grownups about this in a couple of weeks, but so your lungs have these little tiny alveoli, which are little sacs, like little air sacs, right? And they're at the very end of all. So if you picture like the tree of your lungs, those little sacs are at the very end. If you breathe shallowly, less of those really open up, and what happens in the alveoli is that you have the gas exchange. So the oxygen comes in, the carbon dioxide comes out. So you can imagine that if you only opened up, say half of those little alveoli, you're getting quite a bit less of that gas exchange happening. So, when you do shallow breathing, you just don't, you can really feel when you do a deep breath how much more your lungs expand. And that just really represents that many more alveoli that are not opening up all the way. So there's been some studies about the slower breathing. There's a bunch of resources at the bottom of this handout. The Russo one is actually a really great overview. I like that one. But so one of the big sort of one of their conclusions is that slow respiration at 6 breaths per minute, which is really pretty slow. That's like about 5 seconds in, 5 seconds out, was found to be optimal for improving alveolar ventilation and reducing dead space in both groups in terms of increased arterial oxygen saturation and ease and sustainability in terms of respiratory effort. Follow-up of patients with chronic heart failure who practiced slow breathing displayed increased exercise performance and motivation. So what this is telling us is that they did the study to look at if you're breathing more slowly, how does that affect your lungs function, how your lungs function? And they found that very clearly, even in people with more kind of extreme circumstances like heart failure, that they increase their ability to absorb oxygen, but also to do exercise. So some of the claims about slower breathing, there's some validity to them, but it's really surprising how little research has been done. And part of that comes down to the fact that research is expensive and, breathing is free. And so nobody has a really, vested interest in studying breathing unless they have some patented way of breathing, which we'll get into one of those. So yeah, so pretty much that's part of why we just don't have a whole lot of research, it's because nobody's paying for it. So the one of the claims that flies around is about metabolic rate and how deeper breathing can increase your metabolic rate, and there is some validity to that. So specifically the diaphragmatic breathing, the belly breathing, where really it's a deep enough breath so that your belly kind of comes moves forward, moves out. That has been shown to increase the resting metabolic rate, which makes sense because it's increasing circulation, so it's moving waste out and nutrients in. It's also increasing oxygen movement through the body and increasing the release of carbon dioxide. So all of those things make it so that if you're not breathing deeply, theoretically you would be kind of creating a little bit of a backup on the release of carbon dioxide. You'd be sort of not getting enough oxygen, and therefore all of the metabolic processes do require, not all of them, but the kind of the heart of the metabolic process, the ion channel really affects, or really depends on that oxygen in order to function. So all that to say, there's some people who talk about, and there's a couple studies that note that when people are doing these breathing exercises more regularly, that they actually do find if they have some weight that they'd like to lose, or like weight that feels like excess weight, that they actually do often notice some weight loss during that time. So that's an interesting little thing, and it makes a lot of sense. The other thing that actually has been shown is that deep breathing exercises for people who have kind of a strong appetite, or who kind of never really feel satiated, or sort of feel snacky all the time, deep breathing exercises will help them decrease their appetite. And I know some people who do this even as like a practice, if they come home and they know that that's the time that they usually raid the kitchen, they just like sort of stop and take some deep breaths and find that they don't have as much of that inclination. And that's partly what we're going to talk a little bit about, the effects of deep breathing on your autonomic nervous system. And that's partly the reason, is because when you're not getting enough deep breathing, you actually your stress hormones go up, and so whenever your stress hormones are up, they're going to make you crave those calorie dense foods, and lots of them, and make your appetite go up. So really that can be a really helpful tool in that regard as well. Just really anytime that you notice like a stress response is a really great practice to just do some deep breathing, and you'll often find that kind of takes down the stress response quite a bit. And deep and slow breathing has been shown to improve circulation. So it really, specifically the return of so it's called venous return, but it's really about the return of the blood from the extremities back to the heart. And so that really also allows the oxygen rich blood to go out to those extremities as well. Because if that venous blood is really pooling, it slows the movement of that oxygen rich blood as well. So there's kind of this whole way, in terms of physics, that your heart can actually pump differently, and that venous return can actually work better when you're breathing more deeply. So definitely, sometimes people who have, cold hands and feet, sometimes actually doing deep breathing more regularly can help with that as well. And here's this quote here. It's it's a hefty quote. It's very thick, because there's a lot of, I'm not going to read the whole thing just because it's a long one. But one of the things that's really important about this quote and this finding is that a lot of people talk about deep breathing, improving your parasympathetic tone, which is the rest and digest. And that is true. And also really the finding is that that deep breathing really creates a nice balance of so the sympathetic nervous system is the one that has like the fight or flight mode, the responsiveness to a stressor. The parasympathetic nervous system is more of like the rest and digest, all those functions of healing and resting and recovery. And so deep breathing actually can, make a nice balance between those two. And really make it so that you can respond to stressors, but then also have a not stay in that heightened state for quite as long as you would if you weren't practicing deep breathing. So that's what that whole big hefty quote is all about. So pretty much, there is a lot of solid studies about this deep breathing. And it doesn't mean, you have to do it all day long. It just means, for a minute or two here and there. I will mention a couple of apps and things that people use to do that, but some people just have a little reminder, that goes off, and then they just do, 5 or 6 deep breaths, just to kind of have that calming effect there. Any questions about that? Okay. So mouth breathing versus nose breathing. This is the one that has gotten a lot of attention because of James Nestor, but is actually really legit. So he was part of a study where I think it was for 2 weeks, they plugged their noses all day long. So they have a very, complete plug of their nose. And, there's all these different changes that he noticed in terms of his overall health, but also apnea and snoring increased, partially because of how his airway shifted a little bit. And most of us can relate to that, even just, having a cold, you're a lot more likely to snore when you have a cold. And people who do tend to nose breathe at night are a lot less likely to have apnea. This is like a perfect example of where it's like, chicken or the egg, is it, do they have apnea because they're not able to breathe through their nose, or do they have apnea because they didn't breathe through their nose? Like that's, really it's kind of there's this sort of like where we can notice that two things are associated, but it's a big deal to call them causal. So, we could say like, everyone who, has heart disease wears shoes, but we can't say that because wearing shoes causes heart disease. Like this is because those two things don't really correlate. There's quite a few mouth breathers who do not have apnea. There are some generally nose breathers during the day who have apnea, so we can't quite make that causal relationship happen there. That being said, a lot of the interventions for sleep apnea, so sleep apnea is when people stop breathing at night, their airway closes and they have that kind of irregular breathing. Definitely something that I recommend getting treated, because it has so many different health effects, and we'll go through that when we talk about the unconscious breath holding. But a lot of the interventions for that are really to try to get people to nose breathe. So that can be like the breathe right strips that open up the nose. That can be the jaw strap that kind of holds the jaw forward and closed. And so then that way it opens up this bottom airway here, because the kind of like the mouth open, sort of like that laxity here is actually part of what closes the airway. So and there's also something called a mandibular advancement device that kind of brings the jaw forward. But again, all of these are sort of made to facilitate the breathing through the nose as opposed to the breathing through the mouth, because we know that helps with sleep apnea. So there's some interesting information that's kind of, still in progress, and there's still kind of a lot that's not understood about it, but it's also very fascinating. So there's nitric oxide, which is actually released inside the nasal cavity and by the nasal mucosa, and it does seem to have some antimicrobial properties, so antibacterial, antiviral properties. Even at low levels, it can have a really strong effect on bacteria and viruses as well. So so it's doing that kind of so basically in some ways sort of like sanitizing the air that comes through. It also warms it up, so that many of us have experienced going out on a cold day, and it makes your lungs, if you breathe in through your mouth, it makes your lungs kind of like tighten up a little bit. Or for people with asthma, it often will kind of make them have some asthma symptoms. There's also what we know about nitric oxide is that it opens blood vessels, right? And so one of the things that they've studied recently is about this, when we breathe in, and then there's this nitric oxide is added to the air in our nasal cavity, and then it goes into our lungs, it actually helps those little blood vessels, the little arteries and veins in the lungs to open up a little bit, which actually helps them be able to absorb oxygen a little bit better. So that's really, that's a big deal, and probably, something that really supports the idea of breathing through one's nose as much as possible. And I think, there's a lot more to learn about that. The other thing that they've noticed with nitric oxide is that it decreases the risk of blood clots. So it stops as much platelet aggregation is like one of the ways that blood clots form. And so it seems like that extra nitric oxide kind of prevents that from happening as much. So that's, all of those things, really important mechanisms. I'd say, probably this time of year, definitely the antimicrobial aspects really, it's a tricky one because this time of year, many of us at given times have a little bit of a runny nose. So yeah, easier said than done sometimes. I am a big fan of neti pots and sinus rinses. If you do find that your nose, is clogged, also even warm compresses on the forehead can really help to just drain the nose. So that, if you find that your nose is very stuffy. There also are a bunch of these nostril expanders. So they they basically look like there's like a little hook that goes under the nose, and there's a couple different forms. Some of them are a little uncomfortable. So there's 3 different forms. One that looks almost like a little thimble that you stick up into your nose, and it's like a little circular sort of, I wish I had some here for show and tell, but it looks like a little a spring kind of a thing, and it goes up in there and it sort of goes all the way around the circle like that. Some people feel like that one is like a little irritating. Some people really like that one. Then there's also this one, it's called mute. And it's and that one kind of goes back a little bit. So it's kind of, and then there's another one that has like it's like a little line and it expands out this way. So different people will kind of, sometimes I'll look at people's noses and see which direction it seems like their nose needs a little bit of expansion. Sometimes it's worth just trying all of them if that's something that you're interested in trying. I think they're about $10 a piece. So it's okay to try them all. And then the other thing that people do for expanding their nose cavity, if they have like a little bit of like swelling or congestion, or they just can't breathe through their nose very well, say that if they had a deviated septum, but they don't, they're not in a place to get it repaired or something like that. Those breathe right strips are also one of my favorites. So the tricky part about all of these is that they're not really ideal for like wearing out in the world, unless you have a mask on. Then that's cool. You get to get away with it. But that's a lot of people wear them at night for sleeping, and they can actually really help to reduce snoring for a lot of people as well. So there's also a bunch of studies in terms of the difference between mouth breathing and nose breathing that show that mouth breathing is associated with a greater incidence of periodontal disease. So that's really where you have bacteria in your mouth that are causing inflammation of the gums. And what's interesting is that, that is very closely, periodontal disease, very closely related to heart disease. Actually, there's a couple of bacteria that grow that we now know are a risk factor for heart disease, partially because of the inflammation that is being. My dentist, Sally Vale, she has talked to me a lot about how inflammation in the mouth is such a great indicator for heart disease, but also just like how much, what's really wild is in medical school, we don't get trained that much about dental health and about, recognizing dental issues. So every time I see her, she does a little bit more training for me about what to look for. Really, really kind of her and really awesome. And she's amazing, by the way. Highly recommend her. She was talking to me a lot about how, each of these little sources of inflammation, if you have periodontal disease or a lot of plaque that's causing, sort of chronic inflammation, that is, especially for people who have diabetes, and also because of how it contributes to heart disease. So even to the point that when we look for the inflammatory marker for heart disease, we often do think about dental issues. That's the first thing we want to kind of get off the list. So yeah, that's kind of the known things about nose breathing. There's also just the fact of like when the air doesn't get warmed up or get filtered in that way, we're inhaling more particulates, which are like, say if there's smoke in the air or if there's diesel fumes or things like that, we're inhaling more of those deeper into our lungs, as opposed to like when they're in our nose, they kind of get picked up by the little hairs in our nose, a little bit at least. So we get a little bit more inhalation of particulates, and we also get the temperature issue. So I think for different people, the temperature issue, they respond more or less to that. So definitely, there's a lot of reasons that it's good to kind of try to breathe through one's nose. Go ahead.
Acupressure points to help with the nose congestion. Do you have any that would help?
Definitely. Yeah. I like those a lot. So there's this, there's three big ones that I use. So one is right in here. It's like kind of in the corner of between your eye and your nose right here. And that can be really tender when you have the, when you have nasal congestion. So you can do both sides. You even do both sides at the same time. Sorry, that looks weird. And then another one is right here, like right in the little, like sort of where your nose does that little curve thing, right, like here. And that can be really tender when you have nasal congestion. And I'm just showing where they are, but usually to work on them for about a minute is really good. And then the other one is
you massage it. You massage it. Is that what you do?
Yep. You can go up and down like this, or you can go in little circles like this. So yeah, actually feels really good. But yeah, a lot of times when people are in the office, I'll just do those spots and just show them. And especially when you have like that really painful kind of sinus congestion, these spots are miraculous. They're so helpful. But if you're noticing that you're just a little bit congested, also, sometimes people don't even realize that they're often congested. When they start to pay attention to it, they'll realize that. And very often it has to do with like allergies or irritants in the air. So for some people, even I've noticed, this time of year, I kind of keep a lookout if people tell me that they're really congested for talking to them about their candles, because some people have candles and the scents of them are a little irritating. So I've seen that plenty of times that people have either breathing difficulties or nasal congestion. And we just switch out their candles. I think a lot of the pine scented ones seem to be a major issue, as well as some of the ones that are made with synthetic fragrances. Those synthetic fragrances seem to be irritating for a lot of people too. So yeah.
And just another question too about the nasal strips. It says on there not to wear them for a certain period of time. How long can you wear them safely? Is it more that you irritate your skin? Is that what it is?
More about irritating your skin. Yeah, totally. Okay. So a lot of people will wear them overnight. That's a good 8 hours ish. And yeah, it's really about wearing them. And I think part of there's no like drawback to wearing them continuously, except for that irritation, because you definitely would develop that over time. Maybe it's also because they're kind of like wanting to give like reasonable expectation for how long it will actually stay on there, because eventually it will kind of come back a little bit. So yeah. Right. Yeah. But a lot of athletes wear them too, like while they're doing, they're okay to do, wear, as long as you're okay with being seen with them on. But again, the mask can come in handy. But both the nasal expanders as well as those nasal strips, a lot of athletes are, wear them to improve their ability to move air through their nose. Yeah, those are great. Yeah, I'm a big fan of those. Yeah, and they're great even if you have a cold too. They're actually really nice to wear when you have a cold too. So unconscious breath holding. This is one that I talk to people about a lot, and you might be surprised to know that I talk to people about it in the context of pelvic floor tightness. So when people have pelvic floor spasms or incontinence or things like that, I often talk to them about breath holding, because your pelvic floor sort of mirrors your diaphragm. And so if you're holding your diaphragm, you're going to also be holding your pelvic floor. And so a lot of times, really deep breathing is actually very helpful for stretching the pelvic floor. And conversely, the breath holding can really have a negative effect on your pelvic floor. And what cracked me up was that I talk to people about this quite frequently. And it was just a few weeks ago that my kid was with me, and he goes, "Mama, why do you always hold your breath?" I was like, "Really? Do I?" Like I had not, really. I mean, I thought I just hadn't really noticed it, and then ever since he mentioned it, I've been realizing that I do it quite often. So yeah, apparently, for as much as I was thinking about it for other people, I never really noticed it on myself. There is the Linda Stone coined this term, email apnea, because actually they did some studies about people in office environments, and up to 80% of people do unconscious breath holding when they're writing emails and doing certain tasks that are, and one of the things too is it's basically, it is a stress response to hold your breath, and also it creates a stress response. So some people actually do it very consciously to stimulate their own sort of like stress response. Like if they're feeling kind of sleepy or a little unmotivated, they'll sort of like do some breath holding exercises to kind of get themselves to be more focused or more basically to stimulate that stress response. But what happens for most people is that they feel very, very stressed during the course of a day, and as they're at work, and then they and breath holding is part of what's kind of stoking the fire of that stress response. And very often people will find that if they catch themselves holding their breath and stop doing that as much, that their stress level just really comes down quite a bit, which makes total sense. Their physiologic stress level, their body level stress level is really coming down. So when you hold your breath, your cortisol does go up, makes you hold on to more sodium, can make your blood pressure go up. Also too, it is, again, this is me making my own personal leap, but sleep apnea has been associated with heart disease, diabetes, increased blood pressure, atrial fibrillation, weight gain, and to me, I think, nobody's ever done this particular study because it's a harder one to do than sleep apnea. Sleep apnea is a lot easier to measure. That it follows that some of those similar effects would happen from breath holding during the day as well, just because you might not get to as far as you would with sleep apnea in terms of oxygen deprivation, just because you're conscious and you won't really can't get that far, but at the same time it makes sense that all of these effects to a lesser degree would be playing out if you're having frequent breath holding. So then there's also this other side of things that is where people are intentionally doing this breath holding, both, like I mentioned, for to improve their sort of focus and motivation and everything, but also to increase their exercise stamina and exercise tolerance, because basically getting that higher level of CO2, sort of getting used to that actually can help you push harder when you're exercising. So or to do some deep diving and things like that. And I'm going to shift down, actually, before we get it, we're going to end with the breathing exercise. I'm going to shift down to the bottom part about buteyko breathing. So that's one that's been widely used and has been shown to, for people with asthma, can help them decrease their need for bronchodilators, which are like inhalers and things. It's pretty highly debated in the medical community, partially because the research isn't that good, and the basic assumptions or basic beliefs of it, which is that it's better to have less CO2, and that it's better to breathe less. Both of those are really not substantiated. They're not supported by any evidence. So anecdotally, I see a lot of people having, saying that buteyko breathing is very helpful for them. Buteyko breathing it focuses a lot. I have a limited knowledge about it, so I just more know about the controversy around it. But it focuses on this control pause, which is the period of time between breaths, and so it's trying to increase the space of time between breaths. So what you do to test your control pause is you breathe out completely, and then you hold for as long as you can after you do this exhalation. The average is, beginner is about 15 seconds, but people work up to about 40 seconds or more as they're doing some of the buteyko breathing techniques. So I'm not recommending this per se, and also I don't think it's harmful if you do try it out, or I don't see any reason why it's harmful. I don't know if a lot of the claims about buteyko breathing aren't really are a bit of a stretch and don't have the research to back them up, and also I don't think it'd be harmful. And I always think it's worth trying things, because for each of us, clearly buteyko breathing has some benefit for a lot of people. So it's definitely something to look at. And then just to be more specific about what we're talking about when we talk about slow breathing versus normal breathing. So normal breathing is 10 to 20 respirations per minute. Slow breathing is closer to 6 breaths per minute. So that, and when I'm measuring people's respiratory rates in the office, very often they're up in the 18 range, 16, 18. That's not unusual, just because most of us breathe really pretty shallowly. So now we've finally gotten to the breathing exercises. Any questions about all of that?
I've seen these devices that have, and I don't know how it works into this. They have like 3 different color balls. You blow, you inhale.
Yep.
What is that for? Is that,
Yep.
would that help with breathing?
Right. Yeah, that's actually a peak flow meter. And so that that is actually really helpful for breathing. You know, athletes use it. A lot of people with asthma use it both as diagnostically or sort of more of as like a being able to do like a an assessment of how they're doing that particular day. And sometimes that helps them really determine what medication they need to use that day. So that tells us, how hard the lungs can push out. And so when you're having asthma or having any tightening of the bronchioles, you won't be able to push the air out quite as quickly, because you're going to be pushing against sort of resistance in the airways. And so what you do with those is you breathe in and then you breathe out as quickly as you can, and it'll give you a little reading about how hard you were able to push, and that gives you a good sense about asthma. But in terms of athletes using it and everything, a lot of times what they're doing is they're trying to really maximize their lung capacity. And so a lot of people are doing things like practicing breath holding, but also doing that peak flow measurement to try to enhance their lung capacity and their ability to use oxygen. There's also the one that people have that's when they're in the hospital, that little one with that you have to do the inhalation with, and that one's for preventing pulmonary embolisms, and that, because it's basically making sure you're taking deep breaths in order to prevent pneumonia or those kinds of hospital-based issues that come up, and pulmonary.
So it's more of a diagnostic tool versus something that helps train you in breathing correctly.
Right. Yeah, totally. Yeah.
Okay,
Both, the one in the hospital where you're inhaling, that one is more of like a trainer, and the peak flow is more of a diagnostic tool, although some people do use it as like a trainer to kind of like try to bump up their peak flow, but that's
right.
That's sort of a small group of people. I wouldn't necessarily recommend it as like a for most people. For most people, actually just doing the practices is a great way to do the training, so you don't even need anything, no like gadgets, which again is probably why there's so little. There's been these different gadgets that have come around, but then the studies about them, there was one that had a really funny name. It was something like something city. Oh, I forget what it was called, but it was found to not really have any effect at all. That was like a breathing trainer. So just doing the exercises actually really helps. And what we can see, and I've seen this in the clinic, is that the respiratory rate can decrease if people have been doing breathing exercises. So they're just daily, all the time, respiratory rate will decrease. So they're, even though they're only doing that exercise for a few minutes a day, it changes their set point a little bit. So in terms of our breathing exercises, we have the belly breaths, which are really, a lot of people are familiar with these, and there's so many variations on each of these. So, people get into yogic breathing and lots of different variations on each of these. And also these are kind of the basics. So, really with a belly breath, you're kind of taking a deep breath through your nose, and very importantly, kind of with a hand on your belly, or some people even put like a tissue box on their belly when they're lying down and sort of watch it go up and down. But I really think the whole good old hand on the belly is a good one. So you go and then out through the lips. And there's different counts that people use. Sometimes people, if you want to have more of a relaxing effect, the idea is just to lengthen the exhalation. So a lot of times a 4 count in, 6 count out is a great relaxing breath. There's lots of variations on that, and you can kind of find what works the best for you. Some people just do a 5 count in, 5 count out, kind of very, very gentle sort of inhalation out, exhalation there. And then there's the pursed lips. And what this does is actually kind of slows down the exhalation. So that way you get a little bit of a longer exhalation. So this is the one that people often use with that 4 and then 6 count. So 4 count in breath and 6 count out breath. And some people add a little bit of a hold at the top. So they do through their nose, they do the 4 count in breath. Do a little hold. And then through pursed lips, like you have a straw. 6 counts. So really that the pursed lips just do kind of like slow things down a little bit on the exhale. I also just think it kind of creates more of like you're more actively sort of focused on inhale versus exhale. And then for more of an energizing effect, there's a breathing technique that can be a little bit more energizing. So you're basically doing both of them. You're doing a quick breath and then a longer breath. So you go. Actually, a lot of people do the exhale through their nose as well. So like that. And it is pretty amazing, actually. That one, it is, I do that sometimes when I'm feeling a little bit tired. It can be quite energizing. So something to do if you just have like 1 second and no ability to just get up and take a walk or something like that. So in each of these, doing them for about a minute does have a difference. Some people are doing them for more like 45 minutes as part of a meditation practice. Really though, doing them for like 1 minute a couple times a day is going to make a big difference. And also having a practice of when you're feeling stressed, pulling these in as ways to deal with that, with the stress response. There's a lot of good apps out there. So there's ones that have little like little designs that sort of go in and out, so you can breathe with the design going in and out, which is actually, I find, very relaxing and very, very nice to focus on that, because it helps me focus on it. And even the Apple Watch has that little breathe app that has that little flower that goes in and out. There's, on the Calm app, there's a lot of different breathing techniques and breathing, like sort of people doing guided breath work. And there's also an app that's called, let me see. It is just called Breathe. So it's an app called Breathe that I like, that does have more of those little pictures, but also does have some more guided breath work type exercises. So, all in all, I think that the two big take-home messages are: the more we can pay attention to our breathing and sort of slow it down whenever we get a chance, or whenever we're feeling stressed, very helpful for managing that physiologic stress response. And then the other take-home is really to keep an eye out for that breath holding, because of the ways that it both increases our stress and also can have some detrimental effects on our whole nervous system and our whole system, because of how stress hormones affect our whole system. And then these resources that I listed here, there's just sort of like the studies that are out there. And one thing, if you look at these, is that you'll really see how little studies, how little this has been studied, for as many claims as are out there about breathing. It's very little sort of evidence there. And that Breath by James Nestor is actually a really compelling book. It's a well-written, like interesting book. And at the same time, I really do think it does these leaps of cause and effect. And also too, it's kind of, one of the things that I really notice so much about natural medicine is that there's this whole commerce of the, you're doing it wrong, or be afraid of this thing that you've never been afraid of. And, that people buy things that tell them that they're doing it wrong, or that, that they didn't know how bad it was for them, or they click on it, or they do whatever. And so, and I get a little frustrated with that, just because I feel like it's feeding a very unhealthy part of our modern day society, of, feeding more of like the fear and the stress about health versus the supportive and empowering and strengthening ways of looking at health. So yeah, that's all that I have. Any other questions or thoughts or things to add? No? All
Not
right.
really, other than I realize I'm a mouth breather, so I have to really consciously
Me too.
not do
Me
that.
too.
I just realize as you're talking, I'm like, I'm breathing through my mouth. So
Yeah, yeah, I'm a big mouth breather, and I actually I joked about with the masks. I'm like, oh, I kind of love the masks because you just get to mouth breathe away, and like it's great.
nobody knows it.
Totally right. Yeah, but really, yeah, I'm very much there with you. I think that like my nasal passages sometimes are a little bit like they don't things the air doesn't move so easily through them, and so I definitely want to work on that myself too.
Yeah, it's just I have to consciously think about it.
Yep,
So,
for sure. It's a hard one to break, really. Yep.
it sure is.
That little trick I from a speech therapist, I really learned that like really practicing having your tongue at the top of your mouth and like letting your kind of like your jaw hang a little bit, like not engage. That's a great way to really support yourself and not mouth breathing. She also said it was good for your cheeks.
Interesting.
So,
All
yeah.
right. Yeah.
Yeah. So, all right. Oh, so good. Thank you so much for coming.
Thank you.
I hope
Thank
you
you.
have a great rest of your day.
You too.
Take care.
Bye.
Bye.